filters with the cells. So final product will be we getting the extracellular vesicle mimetics. It's called artificial exosomes. And other method is sonication. We could able to make the artificial extracellular vesicle or exosomes. Further, we can make a hybrid extracellular vesicle with the extracellular vesicle and liposomes put together by the either freezing or the extrusion. We could able to make extracellular vesicle mimetics uh, within few seconds. So these are the extracellular vesicle or exosomes or extracellular vesicle mimetics produced. So first study, I will go into the extracellular vesicle from the mesenchymal stem cells. So we could able to use various cells. In this study, we had used stem cells to activate the VGF receptor and accelerate the recovery of hind limb ischemia. You know, India is a much more big population with the diabetic. Usually the diabetic patients will have a critical limb ischemia, especially in the leg. So there may be a loss of leg and further infection. So this study is a preclinical study to evaluate whether the extracellular vesicle or exosomes from mesenchymal stem cell able to revascularize the hind limb ischemia of the mouse. So coming to the introduction, despite all the advancement in the medical field, treatment options for patients with critical ischemia is very limited. The successful isolation of endothelial progenitor cells from peripheral circulation led to significant advancement in the field of biology, and the MSC have been remarkable potential to develop into numerous cell types during early and vital tissue repair. But recently, it was hypothesized that the therapeutic effect of MSC occurs primarily via the secreted factors. So this study investigates the EV derived from MSC in vitro angiogenesis and therapeutic effect in hind limb ischemic model and monitored by the molecular imaging. So this is the methodology. We had used the mesenchymal stem cell, and using the ultracentrifugation, we have isolated the extracellular vesicle, and we treated the endothelial cells, which is important for angiogenesis and revascularization. And we found the proliferation, migration, and the blood vessel formation. In the animal model, we made a hind limb ischemic model, and we using the ultrasound imaging, we confirmed the ischemic model, and then fluorescent and the nuclear imaging, we confirm the therapeutic effect. So first, we will go into the results. Uh, the isolation and characterization. You can clearly see that the extracellular vesicles are small in size, even smaller than 200 nanometer. And then we found the exact size of the extracellular vesicle we isolated from the MSCs. Those were around 134 nanometer. After confirming the size and the morphology of extracellular vesicle, we characterized by using the Western blotting, confirmed the ALEC CD63 is a positive marker and the other three is a negative marker. After confirming the extracellular vesicle, we checked whether these extracellular vesicle EV induce endothelial migration and proliferation. Endothelial migration and proliferation is very important for angiogenesis. So these results show that the extracellular vesicle from MSC induce the migration as well as the proliferation. So after checking the migration and proliferation, we also checked whether it can able to make a tube formation in vitro. After treating the MSC extracellular vesicle, we could clearly see that the extracellular vesicle induced a tube formation in the endothelial cells. With this result, we confirmed that MSC exosomes are extracellular vesicle able to promote the endothelial cell tube formation, proliferation, and migration. And further, we wanted to check whether these extracellular vesicle induced migration, proliferation, and tube formations are through the signaling pathway. We have checked the vascular endothelial factor receptor 1 and 2. These are the very important receptor which receive the extracellular vesicle signaling molecules into the endothelial cells. So we could clearly see that the extracellular vesicle from the MSC are induced the VGF receptor 1 and 2 and also phospho-SRC. And further, we checked whether the proliferation migrations due to the factor of phosphorylation of AKT and ERK. And further, we also confirmed the gene expression in the endothelial cells. And the fluorescent imaging clearly show that when the endothelial cells are treated with the MSC-EV, the receptors 1 and 2 are significantly increased compared to the control group. So these two results show that the extracellular vesicle or exosomes from MSC induce the angiogenesis through the VGF receptor 1 and 2 and downstream pathway of phospho-ARK, AKT, and also we confirm the gene expression. Further, we wanted to identify what is inside the extracellular vesicle, and then we confirm the VGF. VGF is a growth factor, vascular endothelial growth factors. These growth factors are important for producing blood vessels. So we confirmed that this VGF is present in the MSC-EV. And further, we also checked the microRNAs. You know, microRNAs are very small RNAs, even smaller than the mRNAs. There is a microRNAs 210 is responsible for angiogenesis and blood vessel formation. When we confirm this MSC-EV, the blood vessel forming microRNAs were present very high compared to the MSC cells. So these are the factors which involves in the angiogenesis which were present in the MSCs. So that MSC could be able to produce angiogenesis in vitro. Further, we checked in the mouse model. After we inject the MSC-EV into the mouse hind limb, and then we checked how long this MSC-EV is present in the mouse leg, and 48 hours we could see that the EV were present in the mouse liver when we used the gel mixing with the gel. Without the gel, it stays up to 36 hours. We couldn't see in the 48 hours. So this is the experimental plan in the animal model. First, we made a ischemia by cutting the blood vessel in the leg and doing the surgery. After surgery, we confirmed the successful hind limb ischemia using the ultrasound imaging. After ultrasound imaging, we did the gamma camera imaging, usually done in the humans. So this we performed in the mouse. And further, we gave 3 treatments. One is a control treatment and MSC-EV and the MSC-EV with the gel. And we gave these days treatment, and then we also confirmed the therapeutic effect by the optical imaging and also gamma camera imaging. So now we will go into the results. After we made the ischemia in the mouse, we confirmed the blood vessel, blood is not flowing in the ischemic model and blood is flowing in the control mouse. So you could see the peaks in this particular mouse because this is a normal leg, but this one is a ischemic leg where we cut down the blood vessel, so you could not able to see the peak. Peak is representing the blood flow and the heart rate. When the heart pumps the blood, this peak will go up in the blood vessels, but when we cut the blood vessel, there is no peak. So with these results, we confirmed that hind limb ischemia model was successfully developed. And then we gave a treatment by using the MSC-EV, directly injecting the extracellular vesicle into the mouse. And then these results confirm that extracellular vesicle injected into the hind limb increased the blood flow. by using the gamma camera imaging. After the imaging, we also confirmed the blood flow using the small peptide. It's a non-peptide small molecule integrin alpha 5 and beta 3 antagonist. Usually, this antagonist is present when the blood is flowing and angiogenesis is present. So after treatment, this is no surgery, and this one is surgery with high limb ischemia, and these two are treatment group. So without any surgery, no signal, but with the surgery, no treatment, we could see a small signal, but in the treatment group, we could see the high signal. So high signal is representing the angiogenesis effect. So these results confirm that the angiogenesis were increased significantly into the mouse. So after the in vivo imaging, we cut down the leg and then we did the staining. So in the treatment group, we could clearly see that the more blood vessels in the arrow indicating the new blood vessel, but in the PBS control group, we could see very less blood vessels. So the airflow, the blood flow were confirmed by the imaging of the blood vessels in the hind limb ischemia. So coming to the summary and conclusion of this study, the present study demonstrated that MSC treatment can improve the recovery of blood vessel perfusion into an ischemic mind model
The recovery of blood
in VGF receptor,
perfusion.
promoting the increased endothelial cellular proliferation, migration, and neoangiogenesis. Further, this study into in vivo mouse model using the fluorescent and nuclear imaging, which was adapted in preclinical and clinical use. Especially the nuclear imaging is already in the clinic, so it can be used for the human. And overall, this MSC-EV, the exosomes are based study was developed for treatment of fine limb ischemia. So I will move into the next study. So you know the hair loss is another regenerative effect. So mostly the hair loss is a very common medical problem affecting both male and female. So this is the male pattern of hair loss and this is the female pattern of hair loss. So mostly the dermal papillae and the outer reed shoot are known for the hair loss. And potential causes of the factors are whether nutrition deficiency or hormonal changes or treatment with the various medication and surgery. However, the drug treatment like minoxidil and the phenazoride are a short improvement after you stop the treatment and the hair loss is continue. So, and also surgery are limited because the donor hair follicles were less. Therefore, we wanted to develop a novel strategy with a long-term efficacy in hair loss treatment. As I said before, the extracellular, here also we use the extracellular vesicle and the study is a macrophage-derived extracellular vesicle. Previous study we used a MSC cell and this study we had used macrophage cells and macrophage derived EV encompassing Wnt protein activate beta catenin signaling in hair follicle cells and promoting hair follicle regeneration in mice and also in human hair follicles. So these are the methodology we used. I will go into the results. So as I said before that after isolating the extracellular vesicle from the macrophage, we confirmed the size. After we performed the nanoparticle tracking analysis, we could confirm the size were around 130 nanometer. And also we confirmed various positive markers, Alex CD63, TSG101, and negative markers. So these results confirm that extracellular vesicles were significantly increased. The macrophage, we confirmed the Wnt3A and the Wnt7b. These are the proteins which are important for producing the hair follicle, hair growth. So these Wnt3a and 7b were significantly present higher in the extracellular vesicle compared to the cell. And through the FACS analysis, we also confirmed the Wnt3a and Wnt7b were present highly in the EV in the membrane. And then we checked whether these extracellular vesicles are internalized into the dermal papillae cell. As I said before, the dermal papillae cells are very important for the hair growth. So we have tested this dermal papillae cell treatment, and it increases the proliferation. Proliferation is a cell growth. When we treat the extracellular vesicle, cells of the hair follicle cells grow higher compared to the control treatment. Similarly, the migration. And after we checked the signaling pathway in the DP cell, we confirmed that the MSC-EV treatment significantly increased the beta-catenin, ALP, versican, and the proliferation markers are significantly increased, and the survival marker and the proliferation and migration markers are significantly increased. And also, as I said before, the Wnt3a and the Wnt7b are known to activate this gene, taxin2 and LEF1 gene. These genes are very important for the hair growth. So these genes were significantly increased in the hair growth, DP cells. Further, we confirmed how long this macrophage EV are present in the mouse. So we removed the hair of the mouse and then we injected into the skin of the mouse, and then we checked the hair follicle MSC-EV in the mouse, and then these EVs were present up to 72 hours. This is the plan of the treatment. So we had given the 4 treatment group, control group, and the 2 dose of treatment and the positive control. This is the minoxidil, is a positive control, already is used in the clinic in human. So we used this as a positive control group, and then we removed the hair follicle and we gave the treatment. So after 28 days, the control group hair was not grown very well, but in the treatment group, hair grown very high, and also in the minoxidil. After sacrificing these mouse, we confirmed it with the hair follicle size and also the dermis length. And this one is a human hair follicle. We have collected the human hair follicle from the patients, and then we treated the extracellular vesicle, the nanosomes, into the hair follicle, and then we checked the 3 days and the 6 days. So we could clearly see that after treatment, hair follicles were grow big compared to the control. And this quantified data show that these extracellular vesicles, the nanosomes, increase the hair follicles. This is the patient 1. We also checked in the different healthy individual, up to 5 patients. So most of the healthy individual in hair were grown in the hair follicles. So coming to the conclusion of this study, the presence of Wnt3a and 7b in protein in macrophage EV were showed, which are associated with the membrane, and macrophage EV promoted the proliferation, migration, and activated the Wnt3a signaling in dermal papillae cell. And also these results show that hair regeneration and transform the hair follicle by enhancing telogen to anagen phase. The MAC-EV increased the hair follicle shaft elongation in human hair follicle. And this study, we have got the patent, Korean patent for this macrophage EV in hair growth. So this is our group, and this is our school. Thank you. If you have any question, please go ahead. Hello, Dr. Santosh.
Yeah. One second.
Okay. Please go ahead.
Any doubts?
Sir, Tamil.
கேட்கலாம் நீங்க தமிழ்ல கேளுங்க. ஏன்னா பிரசன்டேஷன் பண்றது தமிழ்ல சொன்னா கொஞ்சம் கஷ்டமா இருக்குமே. இங்கிலீஷ் பேசணும். தமிழ்ல சொல்லணும்னா நீங்க பாத்தீங்கன்னா இந்த எக்ஸோசோம்ஸ் வந்து ரொம்ப சின்ன சைஸ். எப்படி சொல்றதுன்னா, ஒரு குண்டூசியோட முனையில நீங்க 1 மில்லியன் எக்ஸோசோம்ஸ் ஃபிட் பண்ணலாம். அவ்வளோ சின்ன சைஸ். ஸோ நம்ம மைக்ரோஸ்கோப் அந்த இமேஜிங்கால கூட அவ்வளோ சீக்கிரமா பார்க்க முடியாது. மோஸ்ட்லி நம்ம டிரான்ஸ்மிஷன் எலக்ட்ரான் மைக்ரோஸ்கோப், எப்படி நம்ம இப்போ கொரோனா வைரஸ் வந்து டிரான்ஸ்மிஷன் எலக்ட்ரான் மைக்ரோஸ்கோப் மூலியம் பார்க்குறோம் இல்லைங்களா? கிட்டத்தட்ட கொரோனா வைரஸும் மேக்ரோஃபேஜ் EV வந்து ரொம்ப பெரிய டிஃப்ரென்ஸ் கிடையாது. ஏன்னா 1 or 2 nanometer to 10 nanometer இருக்கும் வைரஸ். இது 200 nanometer இருக்கும். அதுக்கப்புறம் இது ஐசோலேஷன் வந்து பார்த்தீங்கன்னா, நீங்க அல்ட்ரா சென்ட்ரிஃபியூஜ் இல்லைன்னா ஒரு சில கிட் எல்லாம் கிடைக்குது. நீங்க செல் க்ரோ பண்ணும்போது செல்லை க்ரோ பண்ணிட்டு நீங்க செல்லோட மீடியா இருக்கும் இல்லைங்களா, அந்த மீடியா ஃபில்டர் பண்ணிட்டு அதுலேருந்து நீங்க ஐசோலேட் பண்ணலாம். அதுக்கப்புறம் நீங்க இதை ட்ரக் டெலிவரிக்கும் யூஸ் பண்ணலாம், இல்லை ட்ரீட்மெண்ட்டுக்கும் யூஸ் பண்ணலாம். இப்போ இதில் காட்டு இருக்கோம் இல்லைங்களா, செல்ஸ் வந்து ஜென்ரலாகவே வந்து எக்ஸ்ட்ரா செல்லா வெசிக்கல்ஸ் நேச்சுரலாகவே ரிலீஸ் பண்ணும். பெரிய சைஸ் வெசிக்கலும் ரிலீஸ் பண்ணும், சின்ன சைஸ் வெசிக்கலும் ரிலீஸ் பண்ணும். இது வந்து ஒரு ஆர்டிஃபிஷியல் ஸ்ட்ரக்சரு. பார்த்தீங்கன்னா இந்த எக்ஸ்ட்ரா செல்லார் வெசிக்கல் எக்ஸோசோம்ஸ்குள்ள நிறைய செல் நீங்கள் படிச்சிருப்பீங்க, அமினோ ஆசிட், மைக்ரோ ஆர்என்ஏ, அலிக்ஸு, அப்புறம் mRNA, ப்ரோட்டீன்ஸ் எல்லாம் இருக்கும்ட்டு. அந்த மாதிரி மெட்டீரியல்லாம் வந்து இதில் பேக்கேஜ் ஆகிருக்கும். ஸோ இந்த 2 ஸ்டடி நான் இப்போ காட்டினதில் VGF அண்ட் விண்ட் ப்ரோட்டீன்ஸ், இந்த 2 ப்ரோட்டீனும் எக்ஸ்ட்ரா செல்லா வெசிக்கல் உள்ள ப்ரெசென்ட் ஆயிருக்கு. இந்த 2 ப்ரோட்டீன் தான் வந்து தெரப்பிட்டிக் எஃபெக்ட்டுக்கு யூஸ் ஆகுது. ஸோ ஜென்ரலாக சொல்லணும்னா இந்த நானோ வெசிக்கல் ரொம்ப ஸ்மால் சைஸு, அதனால நம்ம இன்ஜெக்ட் பண்ணும்போது இது வந்து ஸ்கின்னுக்குள்ள, மசிலுக்குள்ள, அப்புறம் பிளட் வெசலுக்குள்ள ரொம்ப ஈஸியாக போகும். யூஸ்வலாக இதுக்கு முன்னாடியெல்லாம் வந்து செல் தெரப்பி தான் கொடுப்பாங்க. மீசன்கைமல் ஸ்டெம் செல்லு, அப்புறம் அதர் செல் தெரப்பி கொடுப்பாங்க. செல்ஸ் வந்து 20,000 நேனோமீட்டர் சைஸ் இருக்கும், ரொம்ப பெருசு. சம்டைம்ஸ் பிளட் வெசல்லே இருக்கும், லங்ஸுக்கு போயிடும், சம்டைம் லிவருக்கு போயிடும். அப்புறம் நம்ம இம்யூன் சிஸ்டம் வந்து அட்டாக் பண்ணி அந்த செல்லை கில் பண்ணிடும். பட் இன் கேஸ் ஆஃப் எக்ஸோசோம்ஸ் வந்து நானோசோம்ஸ் செல்லால் ரெகக்னைஸ் பண்ண முடியாது அவ்வளோ சீக்கிரம். ஸோ இம்யூன் சிஸ்டத்தை ஓவர் கம் பண்ணிட்டு அங்கே போக வேண்டிய இடத்துக்கு போய் ட்ரீட்மெண்ட்டு ஏற்ற மாதிரி டார்கெட் பண்ணோன்னா தெரப்பி கொடுக்கலாம். ஷார்ட்டாக சொல்லணும்னா தமிழில் இதான் சொல்ல முடியும்.
So any clarification?
Hello, sir.
Please, சொல்லுங்க. Please go ahead.
Sir, for plotting regression values and standard deviation, which application or software would you prefer the best?
So I generally use a GraphPad Prism.
Okay.
So we could able to make a graph and also static analysis with just fingertips. Just you plot, put the values into the column and just click which is
Okay.
which kind of graph you want and which statistical analysis test you want. So within just a few seconds you can get the result.
So
So I
is that free
generally
application?
it's free for 1 month, not a free application. But
Okay.
students, it's $100 per year, 6,000 rupee, 77,000 rupee per year.
Okay.
So you
Thank
can use Excel as well.
Okay. Thank you, sir.
You are welcome.
Any doubts? So Sneha,
Sir?
yeah, wind up the session. So tomorrow's session.
Okay, sir.
Thank you, Prakash.
Okay, thank you
Okay,
for
thank you
having me.
much. Yeah, Sneha.
Yes, sir.
Yeah.
We would like to thank Dr. Prakash Gangadharan for giving a amazing lecture. He had answered our questions very well. Thank you so much, sir. Hoping to see many lectures from you. Thank you, sir.
Thank you.
Very good.